My name is Leta, and I am a chaplain here at AdventHealth Ocala. My role as a chaplain is to provide spiritual and emotional support to patients and families, and also to our incredible staff members. I've been a chaplain for just a little over 4 years, and I've been here in Ocala for about 2.5 years. We've been going through a lot together as a team, and we know that we are there for each other. It is an absolute privilege in my role as a chaplain to be safe space for staff, to be safe space for patients, and to build that teamwork together. They know that I'm here for them in an emotional way. Coworkers support one another on a daily basis. The level of teamwork is phenomenal, and especially in the care of our COVID patients, it really takes a tight team working in concert to support them, and I see it on a daily basis. This just happened in the last week. I was rounding on our Care 19 unit, and there was a patient on a BiPAP who was struggling to breathe but also crying at the same time. And I stepped into her room and asked if I could pray with her. She nodded her head. And so I had a beautiful season of prayer with her. And when I finished that, I asked her, I said, "What is your favorite color?" And she mouthed the word purple, and I said back to her, "Am I hearing you say purple?" And she nodded her head. And so I went down to our office, and we've had these wonderful volunteers who have crocheted these gorgeous prayer shawls. And I found a purple one for her, and I took it up to her room. And when I handed it to her, she grabbed it like it was a life preserver. And I said to her, I said, "This is a prayer hug from my heart to yours. I want you to hug this prayer shawl and know that I am praying for you, that your Holy Spirit will prompt me to pray for you." And I was blessed this morning to connect with her mother, who came in to grieve the death of her daughter. And her mother said to me, I shared the story of the prayer shawl, and her mother said to me, "The last conversation I had with my daughter, I couldn't understand what she was saying. She says, 'I'm hugging my blanket, I'm hugging my blanket, I'm hugging my blanket.'" And I was able to close that circle for the mother, that that's what her daughter was doing. She was praying. She was holding on to prayer as her life preserver at the end of her life. Tears are appropriate. It's okay. This reality is so grief-producing, and tears are the only appropriate response. The biggest thing my heart wants to say today is that the layer and level of moral distress to our healthcare workers is enormous. It is enormous. And the layer of and depth of grief for all of us, not just patients and families, but to every person from our environmental services staff to the CEO, the level of grief that we are experiencing is colossal. We are with this together with this community. We are here to serve. We are here to extend the healing ministry of Christ to the best of our ability.